Hello and welcome to the Swine Disease Reporting System. This is the report number 37. We're going to cover the findings from the month of February. My name is Edison Magalhães here at Iowa State University.
Hello, my name is Giovanni Trevisan here at Iowa State University.
Hello, Daniel Linhares at Iowa State.
And today we're going to cover the results from the month of February of 2021. But first, we have the pleasure to have here Dr. Cesar Corzo from the University of Minnesota. Dr. Corzo is an associate professor at University of Minnesota, and he coordinates the Morrison Swine Health Monitoring Project, MSHIMP, which monitors the incidence of and prevalence of PRRS in the U.S. and also PED. And it's going to be a really good conversation, especially Dr. Corzo, because most of the invited speakers that we invite here, they talk that, especially the practitioners in the field, they say that they like to use both reports, the SDRS and also the MSHIMP, to understand what is happening in that specific month. So it's a good moment to do that right now, right, with PRRS and PD, everything going on. And your second time here, so thanks a lot and welcome.
Thank you for the invitation, Cesar. I'm happy to be here with you today to visit about all these things that we like.
Okay, so Dr. Corzo, just to start an overall question regarding these projects, in your opinion, what is the value of programs such as the SDRS and the MSHIMP for the swine industry?
Yeah, that's a good question, Cesar. And I think it's going to depend on who sees the reports, right? But I think because both reports complement themselves so well, I think both reports gives the producer, the practitioner, the stakeholders a good idea what's happening in the United States, right? I think it clearly shows what the current trends are. So I think that's one thing that it's very clear that both reports do. So it raises awareness of what's happening. I think the other one is somehow it helps you or helps systems with risk mitigation. So if at a certain point in time they see that there's more occurrence of a specific disease in a specific region, maybe there might be some opportunities to, I don't know, avoid movement of gilts or avoid movement of pigs into those areas, right? Now, the other thing is maybe you can also use that information to adjust your monitoring programs, right? Maybe they're not monitoring for a specific disease, or maybe they're just, the sample size is too small and they just want to increase their confidence level. I think that's another one. And I think the other one that I think we're getting closer to it, to a real time, is the more we get better at comparing sequences in real time, I think that will come up as another value out of these reports.
Yeah, for sure. Especially the 144 that recently happened, that discussion that put together data from the SDRS, the MSHIMP, that collaboration for the swine industry. For sure, it's important, right?
That's a great example, yes. Okay. Yep.
So let's start the report here in the first page, which is the page that covers Pcr detection for PRRS. Giovanni, what were the highlights for the last month and this winter so far for PRRS detection?
Well, as expected, the grow finish sites continues to lead the percentage of positive PCR results for PRRS virus, and the advisory group did point out for us that this detection in winter market animals is contributed by increased detection that occurred in adult sow farms during the last months of fall and beginning of the winter. So those farms did send positive pigs to the placement in the finishing barns. Mm-hmm. So this favors the regional spread of the agent, and on top of that there was some emerging and re-emerging of different PRRS virus strains that was encountered in different regions of the country, and those strains continue to produce a considerable impact in the infected herds. A considerable number of outbreaks was associated with these strains, the PRRS virus LFLP144 lineage 1C variant infection, that continues to be associated with severe clinical signs and mortality in grow finish pigs.
Great points, Giovanni. Thanks. So, Dr. Corzo, as Giovanni just mentioned, like we saw that PRRS detection, at least in the SDRS, was within the forecasted values for this month, but particularly in sow farms, we had a decrease from January to February, which didn't happen in previous years. And it looks like that the MSHIMP report and the PRRS incidence at the MSHIMP report this winter also appears to be one of the lowest values compared to previous years. So what are your thoughts on it? Anything related to some specific strategies implemented in 2020? What comes in your mind?
Yes, Edison, and you're right. We continue to see that lower trend this year. I think we are roughly at 50%. Roughly, that's between 350 and 400,000 sows that have reported a break. And surprisingly, it's a little bit lower, right? Which, at the end of the day, it shouldn't surprise us in the sense that there continues to be a lot of effort from producers and practitioners from a compliance standpoint, So I think there's a lot of things that they continue to do that maybe this year we're seeing a little bit more compliance, perhaps, right? After all these messages due to COVID, maybe people have really realized that, okay, we have our measures in place. Are we actually implementing them 100% of the time, or 90% of the time, or 70% of the time, So I'm sure that all the practitioners and producers are always asking that same question, and perhaps that has made the needle move a little bit towards the lower side. Now, I haven't heard of anything specific besides let's go and check what we have and whether we're doing it correctly or not. But I haven't heard that there's other things on top of what we already knew, producers already using or implementing in their system. So it's going to be interesting to see what happens in the next few months, right? As we see a little bit more movement, not only from a swine industry perspective, but also from the people side, in the sense that more COVID vaccinations. So I don't know if that's going to mean more people movement as well, freely throughout the systems. So we'll see what happens. It'll be interesting. I really hope that we don't report more breaks, but unfortunately we know that they're going to happen.
And Cesar, a quick follow-up on that. The incidence, like you said and Edison said, appears to be relatively low compared to the early days of the MSHIMP, 2019 or so. But still, if you look at the prevalence numbers, they appear to be on the high side, right, on the high end. So how can you have a lower incidence with a higher prevalence? Does it have to do with the duration to eliminate the virus from the sow farms, or what's going on there?
You're right. You're exactly right, Daniel. And that's something that sometimes we fail to explain well, that, even though we have a lower incidence, our prevalence continues to remain high, right? Just because, as you know, and you guys have, Daniel, you documented that very well and continue to do it. First persistence at the population level in the breeding herd is quite long, right? And as we add more farms to that unstable category, well, they're going to remain in that unstable category for a longer period of time, just because we're doing more testing, right? So I feel like, we add more to the pile, but we don't take them out of that pile fast enough, right? Just because we have to wait 30, 40, 50, and I've heard of cases of 60, 70 weeks until they go into the next category. So I think that's why our prevalence continues to go up, right? Just because we're not taking herds from the status 1 category to the status 2. So I feel like today we're doing a better job at avoiding those misclassifications, right? So in the past, I know that, and you guys know this very well, that we just were very complacent with the 30 samples per month, right? Nowadays, that has changed a little bit because we're, I think, smarter, and we know that these low prevalences are being detected. So those lengths of closure are increasing a little bit, just because we want to increase the chances of eliminating. So I think that's what it's related to that graph. Also, we stopped seeing that cyclical pattern in that prevalence graph. Again, for the same thing.
Right.
For the same thing, better classification, avoiding those false negative classifications, if you will. And I think that's better. We're putting fewer. I guess we're putting fewer herds at risk when it comes to introducing gilts again, right? So again, it's a pretty an interesting factor there that we're seeing.
So one thing is monitoring, like you said, and the other thing, and just to follow up on that highlight from Giovanni, is the virulence or persistent ability to persist in the population of the viruses, right? One thing or the other, maybe both, two things combined. And more specifically, the hot strain of the moment is that one of the RFLP 144 belonging to the 1C lineage, when you look at Igor's and Kim's classification system, right? That variant. We've discussed that in other meetings and conferences, but anyways, what are your perception on the current situation of that at this moment, Cesar? That specific lineage, the 1C of 144 pattern. How's that going?
Yeah, it's interesting, because we saw this very interesting spike in the months of October, November last year, in this very specific region, where we saw that 90% of the sequences came from a region of a 50-mile radius, So we said, well, this is kind of odd. But then we started seeing a little bit south of that region in another state. So we know that it's out there, that it was spreading. It was just a very specific situation in here. I think we're just approaching 100 sequences in our database that relate to this cluster. And I think there might be more outbreaks that we're not capturing. So I think as data continues to flow into all of our platforms, we're going to understand a little bit better what's happening. Now, to me, the striking thing is that it went through a lot of biosecurity programs that I don't think they were bad, but I guess it just got missed, So to me, today, I think people are smarter and they say, okay, it happened in October and November and December. We better make sure that things are better, because that we're not out of the first season until we get to the May, maybe June, right? We always see that little spike in April. So I think maybe people have realized that all the information that you guys have shared, that we have shared, it has raised awareness, and maybe that may have slowed it down a little bit, because we haven't seen that many occurrences or reports in the last few weeks now. So hopefully it'll stay like that. So knock on wood.
Yeah, knock on wood.
Oh, yeah.
And it was great to see that specifically webinar focus on that, because if you think about, they did that pretty fast, like putting data from the MSHIM, from the SDRS.
The Chic webinar, right?
Yep. The Chic webinar, bringing people from the field, like Dr. Paul Yaskin, bringing his perception. And they did that in a really, really fast time, bringing a lot of information, very important information. Maybe in other country that wouldn't occur so fast, let's say like that. So
yeah, and when we look for this type of information, we have this example of the ones 144, but there is other regions that are reporting other strains. Like on the report, we say that there was increased activity in the Ohio, Indiana states, and some person over there is reporting 174. On the Nebraska is reporting like a 184. So these regional patterns, it's something that need to be further explored and compare with this database of your individual production system to help yourself to decide what is the time to make some interventions and apply better biosecurity and biocontainment practices.
Exactly, and that's a great example, how these two reports contribute to the industry, because we're just raising awareness of a problem, right? Hey, this is what all the data that everybody makes the effort of sharing with us. So you manage it in a way, we manage it in another way. But at the end of the day, we're just telling them we're seeing something different that we hadn't seen in the previous months or previous year. This is what we're seeing, so that everybody's aware that, okay, this is happening. And if they happen to go through an outbreak that kind of resembles the 144, which I think that's a different discussion, they can at least start investigating whether that 144 is the same as the actual outbreak that's ongoing, right? So I think that's important. One other thing that I realized is that I'm sure this is not the first one. Like others have said, this has happened many, many times in the past, but I think this is different in the sense that we are reacting way earlier, so that people can at least have the opportunity to make strategic decisions. Not moving gills or vaccinating ahead of time, or depopulating if they need to depopulate, or trying to move pigs away from sow herds so that they can protect the sow herds. So I think that helps a little bit for those that have that capability.
Yeah.
Especially when, and you guys have done that, we have done that too, is disseminate the information for the swine industry and remind people that even though we talk about the U.S. swine industry, there are different regions and there are different types of operations, right? So when we disseminate the information, we can let people understand if we're seeing or hearing or have evidence of what's going on. And then if we can, and we always try to do that, is it more on sow farms, more on grow finish, more in the Midwest, more in the East or South or West part, right? So as you say, people could be increase awareness, but at the same time, we don't want to panic everybody, right? Without having the having the reason. So that I like that idea of disseminating whenever it's possible to disseminate the information, providing the regions and the age groups that are being affected, right? So that people can make those decisions accordingly.
Yeah, just like a participant told me a few weeks ago, what would have happened if us, SDRS and MSHIMP, wouldn't have shared with the industry what we were seeing? I mean, we would have been blamed for not sharing this information, right? Just like with the COVID situation, right? We can't keep that to ourselves, because our objective is to compile the data, analyze it, and share it with the industry as fast as possible, right?
Yeah.
Right.
Oh, great. Let's move to I wanted to keep that discussion, but we have to move on to the next agent, which is PED, actually the enteric coronavirus overall. So, Giovanni, what were the highlights for the last month in terms of PED?
Well, the enteric coronavirus is interesting to see this beginning of 2021 detection, where PED is following a trend of detection lower of the expected boundaries. On the other side, the Delta coronavirus is above expected for January and February. And we asked our advisory group what's going on, what's the difference from this year, from the previous years, in terms of enteric coronavirus detection. And the advisory group pointed out that in 2020, lots of things occur in the field, and some farms that were PED positive went to the population, so that helps to reduce the number of infected pigs that was sent to the winter market farms. There was improvement in truck washing and the baking system. Lots of efforts in terms of the cleaning and disinfection of the farms, use of validated feed mitigants, and right now it's occurring something in the field that is a less intense finishing barn turnarounds due to lower number of finishing animals that are placed. So this helps us to reduce the pressure of infection, but additionally to that, this helps to facilitate the sanitation practice and reduce the potential transmission of PED from packing plants to the new animals that are going to be placed in those sites. For Delta coronavirus, we are seeing this increased detection for the months of January and February, and this was identified as a local issue. Okay. One question was generated to us that if there was some, in terms of genetic changes of Delta coronavirus, and we run this question to the VDL participant specialists, and they report to us that no evidence of genetic changes for Delta coronavirus are identified up to now.
Oh, great points. So, Dr. Corzo, focusing first here on the PED specifically. So, as Giovanni just mentioned, we saw this lower detection of PED for this year, below the forecasted values for this time of the year. And also, if you're looking at the MSHIMP report, the incidence is one of the lowest in the previous last years. So, additionally to also what Giovanni said from the field, what are your thoughts on that? What have you been hearing from the MSHIMP participants?
Yeah, that's. I think coronaviruses continue to be tricky ones in the sense that the trends are a little bit strange in the sense that PED in our data set, even though it stays a little bit low, every now and then we have this spikes, and clustered by company, right?
Mm-hmm.
Maybe one farm breaks, and unfortunately, the virus is not contained, that it gets into another sow farm that it's close by, or so it has been pretty strange. Now, I think we're about at a little bit below 2%, which it kind of matches what we have seen throughout the year. The last update that we got, we're gonna see a little increase in there, right? But again, it's all clustered by farm, by company.
Okay.
The interesting thing is that most of these sow farms, they haven't had a history of PED in the last, I want to say, couple of years, right, or 3 years. So I think it's farms that are located in high dense regions that hadn't had a break in the last 2 or 3 years, or farms that are in low dense regions or medium to low dense regions, and they have a break. So it's kind of hard to understand what's happening. Again, like you guys said, we're still trying to figure out what's the deal with slaughter plants and moving those viruses back to farms. So that's what I've been seeing, because again, we know that there's some feed mitigants out there. Some may not have it. There's quite a few that do not have feed mitigants that do not break, right? And some that do have it that break, right? So it's still the data is kind of blurry at this point, But we've seen activity in the last few weeks, at least in 4 or 5 states.
Oh, great. Thanks for your comments. Good discussion, guys. Giovanni, moving to the next agent, which is Microplasma Detection. How was the previous month in terms of detection by PCR?
Well, Microplasma Detection is expected to decrease during January, February, and they observed this moderate decrease from January to February. And was an uptick in January for adult sow farms, but now in February that comes to the expected value. So looks like everything is within the expected.
Okay.
And just to clarify to the listener, talking about Mycoplasma pneumoniae, right?
Yeah, correct.
And lastly, you're going to cover the page, bring the updates on the page of disease diagnose, which covers the disease diagnose of tissue submitted to the ISU VDL. Giovanni, what were the highlights for this month as well?
Well, overall, the number of diagnoses here in the laboratory is within the expected for this period of the year. And we just saw an increase, that means signals for number of cases that were diagnosed with Bordetella bronchoseptica during January. Besides of that, we didn't see for any other agent these changes.
Okay, thanks, Giovanni. And thanks, Dr. Corzo. We have a final question for all the invited speakers, and love to hear your answer on that. And was a good discussion so far with focusing here on PRRS and entire coronavirus. But our final question is basically based, Dr. Corzo, based on all the field experience and the university experience that you have. How do you envision the future of disease diagnosis and surveillance in the swine industry from what we are now and to the future?
Oh, that's a good one, a tough one. And if you ask me that question in a few months, I may give you a different answer. But I think there's several things. The first one is time. What I mean by time is we continue to decrease the lag between sample collection and sequence, right? When you get the sequence, right? So I think that continues to be shortened, just because all the labs are doing a beautiful job in the throughput when it comes to sequence, right? And especially now with whole genome sequencing, now we're getting to whole genomes quite fast, right? So, and again, hopefully we have the platform, which takes me to the second point, the platform to analyze that data. So it's not only shortening the lag, but it's also shortening the lag between what we see at the barn level with the analysis, right? So I think those two will go hand in hand. The other thing that I feel like it may happen soon is that that we get a diagnosis at the barn, at the pen level right away. We may not have to, and that's how I envision it. We may get the typical pregnancy test assay, but at the barn level, hopefully, one day we'll get that. But also at the same time, I feel like the closer we get to whole genome sequences, it's not that we're going to simplify our lives. I think we're going to complicate our lives a little bit, but I think we're going to be able to characterize better pathogens over time, right? So that we can assess diversity, right? And the last point that I see is that as growing pig sites start to be monitored a little bit more, with our capability of predicting or our capability of running better temporal and spatial analysis is going to increase quite fast, so that at the end of the day, we're going to be able to give both practitioners and producers a better idea of what's happening in a region in a real or real-time basis, right? Yeah.
Oh, great. I hope we can. Let's see what's going to happen in the next few years and have this conversation again.
Exactly.
So thanks again, Dr. Corzo. Do you have any final comments, guys? Giovanni, Daniel?
Thank you very much for taking the time.
Yeah, thanks, and also always good, and I think it's good to have this conversation, between this collaboration between these two projects, like we both said, one complement each other, and we're both working to make the swine industry better, right? To help them with providing the data and supporting as we can. So thanks, Dr. Corzo. Thanks a lot, and see you guys next month.
Thank you. See you.
Thank you.
See you.